One of the things we heard from our grantee survey was that you've seen a big demand in services since COVID started hitting. And I wonder maybe if you guys could speak a little bit to how COVID has impacted your clients and how you've had to respond to the pandemic.
Dr. Gonzalez,
Yeah,
you're on.
there's well, there's a lot of things that go on in our communities. Sadly, and I want to talk a little bit more about the Mexican community that I see at the Mexican consulate, but this goes to all our underserved communities. And it's been said and publicized all over now that people who are the poorest people, the ones who have lower access to health care, those who are essential workers, are the ones who are suffering the most. And I was just reading some data this morning, and Arapahoe County, which is the county where I live in, has 19% of the population is Hispanic, and 40%, 4 out of 10 people who have been diagnosed or treated with COVID-19 in Arapahoe County are Hispanic. So this is the way that it's hitting our community. And then we start to ask, why does it hit our communities more than other? Well, we've been carrying a disproportionate burden of social determinants of health that are behind us. We suffer from high blood pressure. High blood pressure is pervasive in communities that are suffering continuously of emotional or trauma, we're going to say it like that. We have a high rate of obesity, a high rate of diabetes. But above all, our communities are working out there in front of the people. And there's a lot of things that we've been seeing because at least one of the things that I like to do is to talk with them one-on-one. And most of the people that we've been talking to are essential workers. And I have the girl who sells, or she's on the drive-through providing hamburgers to people. And she comes and says, they don't give us, well, now right now maybe they are, but they don't give us a face mask. We're touching money. They're not training us. They don't give us time to wash our hands. We have people who work in the hospitals and the big hospitals here. I'm not talking about small hospitals, big institutions cleaning their rooms. And they tell them, don't worry, there's no COVID here. And they don't give them proper equipment to take care of themselves. And then we have the cultural part. Our communities like to be together. Our communities need to be together. So social distancing is something that is very difficult to take into consideration, because just imagine a family that mom and dad have to go to work and they have 2 kids. Well, those 2 kids have to be taken care of by someone else. Most of the time it's family, but those family members have to go out and come back in. So all of those things are being disproportionate on us. And just finally, I mean, there's a lot of things that are coming on, but just one that I would like to say is that a lot of our people don't have medical insurance. And a lot of our people, a significant proportion of our people are undocumented or are in a relationship of marriage with an undocumented person. And if they're filing taxes together, they were not able to receive the support money that came from the federal government through Nancy Pelosi and the Congress. It didn't come to us. So these people needed to go to work. Examples, we have a lot of people who didn't want to get tested. When we started our program for testing people, they didn't want to get tested because they said, if I become positive, if I find out that I'm positive, I cannot go to work. So we need to do a lot of education on that sense too.
Wow. Yeah, I think, you painted that picture really clearly, and I think ultimately it just shows how many of the people you're serving are, one, keeping so much of our country and our economy and our communities going and operating. They're the ones who are at the most risk of exposure. On top of that, being at the most risk, they oftentimes don't have insurance, and so they don't have the help they need. They're also fearful of a government who is, targeting them.
Right now, he talked about doctor talked about the social determinants of health. Racism is a social determinant of health.
It almost pervades all of the things that we normally think of as social determinants of health, and kind of It's one of those umbrella issues that affects us in so many different ways. If you could maybe each speak to why you do what you do and why you're in this work and why you serve the community the way that you do and what inspires you, especially in times like these, which are very difficult.
Well, for me, I was hired to lead Servicios de la Raza almost 12 years ago. I'll celebrate I don't know about celebrate, but my 12th anniversary this coming November. 12 years here, and when I got to Servicios, a lot of my colleagues and peers told me I was crazy, that the place was dead, let it die. I was this nonprofit. There was many hundreds of thousands of dollars in debt, and it was a few months from putting the chains on the doors. And but I grew up here in Denver, and I was a youth employee of Servicios in their summer youth employment program in the mid 70s when I was a 15-year-old, and I was able to get a paycheck out of Servicios doing work in the community. And so, and some of the founders were friends of my father's and mother, and friends of the organization my father ran. And I'm a child of the civil and human rights movement of the 60s and 70s and 80s. And my father was very well known, the local Rudy Gonzales here in Denver and Colorado and across the Southwest with especially the Mexicano people, Mexican Chicano people. And so for me, it was like coming home to be able to have that opportunity to come in and number one, resuscitate the organization, and number two, start to rebuild it. And it was coming home. It was coming home to run a community organization of color that was founded by community activists and community members who wanted to provide a better service for our community than the governmental human services entities. And that we know we can do a better job because we come from our communities, because we love our communities like no other, and because we have that spirit, that fierce spirit of self-determination. But